Nurses and midwives in Isingiro, Yumbe, Madiokolo, and Telego districts have been trained on administering new uterotonic drugs to curb postpartum hemorrhage, the leading cause of maternal deaths. Trainers noted that while the sessions boosted skills, some midwives and nurses struggle to adapt to the new medicines. Persistent challenges such as mix-up of uterotonics and poor documentation continue to undermine accountability.
Not had any maternal death related to excessive bleeding after birth, and personally, as somebody who has been using these new products, I want to request and encourage Ministry of Health to help us in delivering these drugs to the health facilities so that our mothers can be saved. While we used these drugs, the main challenge that we faced was the stock out. We got small supply which was used up, and at that time that's when we experienced a surge of postpartum hemorrhage cases. So if this can be resolved, then it will be helpful.
Midwives cited delays in supply distribution by the national medical stores and called for wider training to equip more healthy workers with the necessary skills. A commissioner in the Ministry of Health's Department of Nurses and Midwives pledged government's support to address these concerns.
And of course, there are some other few challenges which they have expressed, because this is a new drug, so there is still usage is still not very welcome by some other stakeholders, especially some midwives, because they are used to oxytocin. Nevertheless, we have done capacity building and there is mentorship which are ongoing to build their capacity. But as they started, they have now gained confidence in using these two medicines, currently depending on the magnitude of the excessive bleeding which this mother express also comes with. And then of course, another challenge is that these two drugs are still not available in the amount which is required.
I'm Bantu Machabe Semambo for UBC.